Hi, my name's Max Zworth. I'm a second year medical student at McMaster University. I just started clerkship about a month ago. So I think that sort of all medical students and health professionals are involved with interprofessional health kind of by default. It didn't take very long, doing observerships and stuff in first year of medical school to realize that whenever you're working on a team, you're going to be automatically working with people from a variety of different backgrounds. And so being able to collaborate with those teams, being able to work efficiently with those teams is a huge part of doing a good job in medicine and making sure to promote patient outcomes as the number one goal. And so I think I recognized that fairly early on in medical school. There's this long-standing conference, the Group Interprofessional Health Leadership Conference, also known as DILEC, which has been running for 10 years now. They put on a really good conference during my first year of medical school, and I was fortunate that the opportunity arose for me to become a co-chair for next year's conference. And that's how I sort of started to take a bit more of a leading role in interprofessional healthcare. I'd say my first sort of contact with advocacy in healthcare came in the summer, 2 summers before I started medical school. I worked at CAMH in the Center for People with Developmental Disabilities, and particularly worked on a project to try to identify barriers to people with developmental disabilities accessing primary care. And so I think that was my first interaction with the world of health advocacy. And then being at medical school, I think what's great is that at McMaster there's a lot of people that are really involved with health advocacy. There are a lot of really interesting and important initiatives that are taking place. And so there are a few people in my class that have been working really hard at Refuge, the Hamilton Center for Newcomer Health, to promote programs that aim to advance the health of newcomers to Canada. So coming back to my time at CAMH, I think recognizing the extent to which little things can go a really long way in terms of helping marginalized or disadvantaged groups. And so one example was with the work I was doing there, our data actually showed that if clerical staff, so office staff at family doctors' offices were trained in how to interact with people with developmental disabilities, that could actually increase the frequency that people with developmental disabilities come back for follow-up appointments and get yearly health checks. And so I found that really interesting, sort of on a number of levels. One is just sort of reminding you that little changes can go a really long way, and that sometimes you need to think outside the box in terms of ways to promote outcomes for certain groups. And I think that experience also taught me the importance of research as well, and specifically research that does focus on certain disadvantaged groups. So that was one experience. I think another experience that went a long way for me in terms of understanding the importance of health advocacy was during my elective on internal medicine CTU at St. Joe's. They recently started an inpatient service for addiction medicine consults. And I think that sort of working closely with those physicians who are on the addiction consult team, hearing the way they sort of gauge what individual patients' needs are and then communicate those needs to the rest of the healthcare team. I'd never seen anything like that in terms of a person using their real both medical and social expertise in order to advocate on behalf of individual patients. So I found that experience to be pretty inspiring, and sort of with that, I think I'm looking to get more involved with that side of inpatient medicine as well. I guess it depends how much energy I have. If I have energy and it's not been too long a day, then I like to play some pickup hockey with some of the other medical students and residents. There's a few fun leagues here in Hamilton that I've been able to play in. Hamilton has lots of good hiking around it too, so going for hikes in the area. if just spending time with the friends that I have made in medical school too. We try to do weekly dinners as much as we can, where we sort of do potlucks together. If I'm not feeling so energetic, then I'll put on some episodes of The Office or Brooklyn Nine. So I think from pre-clerkship, my most memorable experience was the weekend we spent at Docs on Ice in Toronto last year. Docs on Ice is a big hockey tournament for medical students and physicians across Ontario that takes place every year. And McMaster Medical School had a team that played in the medical school division last year. And it was just an amazing weekend to spend with friends, to be able to engage and interact with some of the students from other years at McMaster Medicine. Yes, that was a really fun weekend and a really memorable piece of my first year. In clerkship, I think my most memorable experience so far was an elective in hematology oncology that I did in Toronto at Sunnybrook not very long ago. I think one thing that is really amazing about hematology is that there are some patients who come in who are incredibly sick and who are probably not extremely hopeful about what their prognosis is, and the research that's been done in the last couple decades in hematology and oncology has achieved amazing things, and in many cases we're really able to make patients a lot better. And so to be able to be in a room with somebody receiving a diagnosis of Hodgkin's lymphoma and telling them that our intent in this treatment is to cure you is kind of a special thing to be a part of. Yeah, so there's two main projects I'm working on right now that I'm pretty excited about. The first is a scoping review looking at the medical provision of medical assistance in dying in Canada. Medical assistance in dying made in Canada was decriminalized a couple of years ago. A lot of the research in that area has looked at ethical questions around who should access MAID and what the process should be for deciding when someone might be able to access MAID. But not very much work has been done so far around if MAID is going to be provided, how should it be provided. Questions like where should we be providing MAID, who's allowed to administer MAID, what medications are we using, how do we set it up in order to ensure that the experience is as positive as possible for patients and their families. And so we're doing this project kind of looking at in other places where MAID is legal around the world, how is it provided? And hopefully the project is going to be able to inform future guidelines around the medical provision of MAID in order to make sure that if this is being provided, it's done in a way that's as effective and as safe as possible. The other project that I'm working on right now that has me excited is that I think I mentioned that about a year ago in Hamilton, they started a new inpatient addiction medicine consult service. And so, if patients are admitted to the hospital for something related to substance use disorder, or patients are admitted to hospital who have a history of substance use disorder, often the service will be called and can sort of be involved with their care and focus on that aspect of a patient's medical situation. And right now we're working on a project that's going to try to evaluate that service and see sort of 1 year in, how effective has it been at improving patient outcomes, how effective has it been at reducing the length of stay for patients who are admitted to hospital. And so I'm pretty excited to see what comes of that, and to see and hopefully to use that as an example for other hospitals to initiate a similar service.